Hi, I'm Dr. Bob Perkins, smile and jawline specialist from Malibu, California. Today I'd like to talk about something that most people, even cosmetic dentists, miss about porcelain veneers. Someone comes in and says, I want my teeth to look better. And sure, we can make your teeth whiter and even straighter, but that, in many cases, is just the tip of the iceberg. What we really need to do is step back and take a look at the entire face. Most patients, I'd say more than half, don't really show enough of their top front teeth when they're conversing or when they're just at rest. They're either worn down or the upper front teeth didn't fully erupt due to developmental issues, and so the smile looks dull. It just doesn't look vibrant. And in many cases, to get those teeth to the right length, the most flattering length, we've got to make changes to the bite. You can't just make the upper front teeth longer in that type of situation. If you do, the upper front teeth will completely cover and overlap the lower front teeth, and the bite just won't be well proportioned. It's kind of like trying to raise a table by only lengthening two legs. You have to lengthen all four legs of the table. So what we do is we open the bite gently. No surgery, no drilling. We just bond porcelain to the back teeth and we raise the bite slightly so we get the proportions that we're looking for. This is how we get the face to be in better proportion. The jawline looks much better. The lips are much better supported. And the smile looks in balance with the rest of the face. Now, I'll be honest. This is not easy to do. This is not something you learn in a weekend course. You really have to understand how the bone, the face, the teeth, the soft tissue all work together to create proper proportions. Now let me show you what that looks like. This is someone who didn't need drilling or surgery, just non-invasive bite correction and veneers shaped for their natural face. Now their smile fits their face. Their lips have support. Their lower face looks balanced. It's not just about nice teeth. Again, when I'm designing a smile, it's very important to get the upper front teeth the proper length. But like I said before, you can't really get those upper front teeth to the proper length unless you have the bite proportioned and placed properly. I think that a well-proportioned face really is just as important as the veneers themselves, maybe even more. Not everyone needs their bite changed, I'll be honest, but many of the patients that come into my office do. And if we don't get the bite right, we're not going to get the optimal results the patient's looking for. We're not just designing teeth. We're restoring facial balance. We're bringing everything into harmony, and that is when it looks incredible.